One of the NFL's best players, Tyreek Hill, wide receiver for the Miami Dolphins, just sustained a devastating knee injury. We're talking about a full-blown knee dislocation with a thigh bone and shin bone actually move out of place. Dislocations can happen in different directions and the extent of injury can vary depending on the forces through the knee joint at the time of injury. But these are all hugely violent injuries and there's a real risk of significant blood vessel or nerve injury. Inside your knee you have four main ligaments, the ACL, PCL, MCL and LCL. In a dislocation like this, multiple ligaments are often torn and there can even be fractures of the bone, meniscus tears and cartilage damage. And importantly, there's a group of structures called the posterolateral corner that can be damaged, and this implies a significant injury. With knee dislocations, there's a huge concern about the common peroneal nerve and the popliteal artery, and the standard practice nowadays is to get a CT angiogram of the legs ASAP. Around 20 to 40% of these injuries can involve nerve damage, and a significant number can put the artery at risk, meaning the lower limb may have no blood supply, and this is a surgical emergency to save the leg. A serious nerve injury can potentially result in loss of movement that affects the foot and ankle, and this can often be permanent and devastating for a professional athlete. With these injuries, all the torn ligaments need to be repaired or reconstructed, and this sometimes needs multiple surgeries, though my preference is to try and do it all in one go so the patient has one hit and one recovery. For Tyreek Hill, this is definitely a season-ending injury at the very least, and I'd expect him to be out for at least a year. As a sports knee surgeon, I've treated many of these injuries myself and know just how serious they can be. I often have to tell patients that this can be a career-ending injury, and for some, particularly those with permanent nerve injuries, it can be life-changing. The good news for Tyreek Hill is that his agent has confirmed there is no nerve damage, no blood flow issues, no broken bone, the cartilage is fine. Cheetah is a supreme athlete. I wish him a smooth recovery and hope to see him back on the field next season.